Friends, hello. I'm here with my friend Lesha, and I'm excited because he's going to be cutting hair today. I've always wanted to watch why I'm most interested in this, what interests me.
Look, I have some small bald spots here already, objectively.
I have a scar on my forehead that used to be under my hair, and it's slowly moving further up, this hair growth of mine. And I understand that one day, perhaps I will face this question. The question has arisen here. Are there people who, well, like you, for example, yes, well, he doesn't want to go there in such a variant. And I became interested in how this is done, not somewhere on YouTube when you watch, but live. And such an opportunity has come up. I came to the clinic today to take a look. Today I'm not alone here with us a surgeon, but who?
A whole bad doctor who came from another country to do this operation here.
And how? First of all, hello? Now it's very fashionable to fly somewhere. It has become fashionable to dye hair. For me, it's extremely important that you came here because I don't have the opportunity to fly anywhere. And here I would look at how it's all done when it's done well, correctly. And in general, the more you keep silent, tell you are transplanting for the second time with us already.
Well, good day to everyone. First of all, I want to start with Sasha with the following. I definitely had a similar trigger a certain number of years ago. Especially when someone from the family or spouse says that, "Damn, Lesh, look, you have such deep wrinkles." This probably was the first thing that pushed me to hair transplantation because I was one of those who did not want to put up with this. And moreover, if there is such an opportunity today, I decided to take advantage of this opportunity.
That is, until a certain point, I did not know that you can take hair like this and transplant it.
Lean your head forward. So now we're doing this to Akaki. Yes, yes, too, so that there are no claims later.
By the way, take a shot from above because I look ahead when it's so inconspicuous. Here, take a shot from above. See how it looks. Look, here, it's very visible from above.
Well, this is exactly why I came. I came specifically for the thickness.
That is, I don't even need the length of the hairline anymore. What I need is thickness. And you look up there because you look, well, Vamfas is cold. You look in the face. Everything seems to be okay. There is hair. You lean, God forbid, wet sash. That's all you can say.
What's better to get dirty? You know why?
I call it a daredevil's hairdo. If I go, I'll do it so everything flies off. If there was no chance to fix it, I wouldn't go like this. I would have shaved. But if there is a chance to fix it, then probably, yes. There are studies that say that women and men, including, perceive us, although this is not objective, but they perceive us as less healthy, less productive, less interesting person. If we have boldness.
First of all,
Firstly, the proportions of the face in norm from the bridge of the nose to the chin, from the bridge of the nose to the eyebrows, and from the bridge of the nose to the hairline should be the same.
1, 2, 1, 2, 1, 2.
When the hairline rises, regardless of how a man feels about hair loss, the face still breaks down, the face looks older and less fresh. That's why for many men this is a problem. There are men who don't react to this. Moreover, in my youth, being bald was a horror. Pantomas, who remembers you, young ones may not remember, was a symbol of horror. Now, thanks to the fact that humanity is trying to adapt to this problem, because androgenic alopecia is the main cause of 98% of all hair loss due to androgenic mechanisms. We will talk about this with you. You are a urologist. Here, androgenic alopecia is spreading. It is getting younger. If, for example, 30 years ago there was not such a pronounced hair loss 30 years, now it happens even at 2025. Boys occasionally come with a 7th degree of hair loss. This is a completely bald head. It happens. And therefore, a man had to shave his head bald. And well, it seems this is brutal. It seems maybe someone likes this, someone doesn't, but most men, maybe they don't show it, but I know they are going through it. Americans conducted research with psychologists on those patients who are going for a transplant. And there was such a survey. How many years of life would you give so that this cup would avoid you, so that you would not go bald? The average indicator is 5 years of active life I would give so that I would not be bald. That is 5
Yes.
of life so that I would not be bald.
You mentioned degrees of baldness. What are the differences between them? How many degrees are there?
7. This American dermatologist Norwood, who did a lot for hair transplantation, this is his classification from 1 to 7 degrees. You have a high one. I didn't look at the back of your head, but well, it's normal there. You're considered to be at the 2nd degree.
And, well, I understand. The higher the degree, the stronger it is. And at what degree, for example, do you need to get to the point where you need to start treatment or something?
To do good.
Question, because every hair.
Falls out every day. Good. What is a hair transplant? We are surgeons. You are also surgeons. We do not engage in treatment. What we know, I always repeat this, always joking, it's to cut out and throw away, like an appendix. We don't treat. We cut out the appendix, stone. We cut out the gallbladder. In the best case, we cut out and sew up during coronary bypass. I always repeat this example. We take a vein and sew it in, and we make a bypass to the heart. That's it. The same thing with hair transplantation. We don't stop hair loss. We get to the root. Why the root? The back of the head has different follicles that are resistant to hair loss mechanisms, which we may discuss.
On the back of the head, what kind?
It would be if a person was not on the back of the head. Remember Lenin, Torbachev, Lushkov, there is always a bald spot on the back of the head. These are others scared by the factors of hair loss. Let's just say it straight. They don't have a dihydrotestosterone receptor and they are resilient. That is, we should do a hair transplant when the patient doesn't like their appearance. Do you understand that we surgeons are a bit too condescending towards our ignorance towards therapists? Modern treatment methods help. They can stop hair loss, even improve the situation. We will also talk about this, but sometimes they don't work. These are all transplanted hairs. Well, now I'm boasting. Look how naturally they grow. You would have guessed that they are all transplanted because we restored the hairline and there was nothing here. Here the transition goes into his hair on the dark area. On the top, ours, his. But all these are transplanted, not very possible.
I heard the question right away that they specifically plant unevenly.
So you specifically need to plant. Take a look.
It's visible. I saw many replanted.
Lines and
I liked it. Reminds me of a shoe brush. You know, these brushes are the same. They all look alike and it's visible.
I would have lowered his line a bit. It won't take much. A few hundred grafts is too much symmetry here is not necessary.
But how to determine how many grafts are needed, approximately already by experience?
There is a certain scheme by experience. We can talk about this. There is a classification of people we talked about. And for example, when a person has a 3rd degree, there were somewhere 2000, he needs it. So it goes, but the result of the transplant depends not only on how much graft you transplanted, but also on the thickness of the hair. Like 1 oak will give you more shade than 100 bamboo trees. Yes, that's why if the hair is thin, you need more. If the hair is thick, you need less. Just like that,
I see. He has a hemangioma here.
Yes?
So here it's red and they don't plant in it. They plant next to it. You go around. It's all educated. Preferably
Approximately like this, slightly reduced, allows
We reduce what, how?
Lobe, we lower the hairline. This will do very well. We do once, we do it well.
all now. What are we doing? We never blow up the donor zone, but with this technique, with the crazy technique, it is desirable that the donor zone was sprayed. In principle, it is possible to extract without shaving. I will show you. It is more laborious, longer, 2 to 3 times more time consuming, mainly more. Everyone shaves. Most often we call the recipe never. When we do the transplant, for you nothing was shaved at all.
everyone shaves their legs.
We have a recipe for the fashionable huffbox, military haircut that is suitable for the zone, and we are currently making it.
The crop is called by the youth now, and 7 from here. Show, please. You see, it's visible that there really was a graft. The white spots are those zones from where they took graft.
The patient underwent surgery in Turkey. What the plug has become similar to, that is complete exhaustion. Here are these points, a shear rubel, an ear, or here's another example of hair exhaustion.
They don't understand that they live as if it's not the first day, for some reason.
Does with books.
My mouth's sore like paid.
The doctor there performed the procedure without asking as soon as we arrived and paid.
What are the basic methods of transplantation in simple maximum words so that our viewers understand? There are. They take the hair follicle and poke it into the bald spot in a way.
Well, how to take it and how to do it. There are two main methods and their varieties. The first one is suture. The other one is called follicular. Follicular observation transplantation, it's all the same. How does it happen? From the occiput, it is extracted. There is an extirpation of thin graft. It is stretched, sewn like blepharoplasty, like a lift is done on the occiput, but this graft is not thrown away, but under microscopes. Very high quality grafts are prepared. The grafts are excellent, very high quality, a very good method. But of course, the drawback is the stitches on the occiput, and with a shaved head, the stitches are visible. Although the procedure is very fast and has many advantages. But if a man wants, if for the price of men, because we always operate on women with this method practically, if a man wants to wear a short haircut, or if he's afraid of this seam but doesn't want it, then it's done seamlessly. For this, a hair follicle is extracted one by one with tiny micro-rotating microtractors with a diameter of 0.9, maximum 1 hair.
It takes everything with it. Surrounds.
Like when
Grow. Don't.
resettle. This method is more labor intensive, and the damage, the risk of root damage is greater. That is, the damage of folk accusations with this method.
I can. Immediately, I have a question. I heard about Turkey. I learned for the future, for myself, and honestly, my wife's cosmetologist. He was very angry, let's say, at Turkey because he says that they just fly in from the series there. They do this on the fly there, these graph U series there, broken, fractured, which
Are reshaping very
important to identify, you understand? He
Does.
The tonnage is limited. With crazy technique, you can take 8,000 craft. With a sewing technique, 10,000. Well, as we have 2 kidneys, we can give one. You can't transplant someone else's. That's why it's very important to take care of every craft. It's very important you understand every auto-transplant. Time is priceless because it's limited and unique to each individual. While one may not have an abundance of it, it remains invaluable. That's why it's important to take care of this, take care of every craft, extract its maximum accuracy, delicacy, pamper it. This is what sets it apart. But
the continuity that exists there, I always consider it where it exists.
a large flow, let's say, colleague, the truth. In Turkey, doctors do not do hair transplants. I know very good Turks, very good. There are doctors, very good. There are Canadians, different ones. When, let's say, in Istanbul, there are 3,000 clinics, different ones, and good ones and bad ones. We meet at congresses, I know many very well, but the certainty is that no surgeon operates on a patient. In general, he manages everything. The nurse does everything. All grafts are extracted by a nurse or not by medical personnel at all. This is very important. Do you understand? And they don't hide it. They say each graft, well, 2,000-3,000. The doctor doesn't extract, let's say, if the doctor would extract it, the cost of one graft couldn't be 20 cents. This is excluded. Do you agree? Well,
This is what, for which I, by the way, gathered you together, let's say. Because there are a lot of underwater stones, a lot of these stories. When I arrived, it was quick and beautiful, but very rare. They show us what will be there in 3 years. We can't see it. We don't see it anymore. And so my friend Edward, he says that every 3rd degree is cut off. In the end, it does not grow back. That is, they have replanted, yes.
5. Therefore,
A large number is said.
yes, something will settle down. And the second moment, in Turkey, I believe only MRKRDND does the stitching operation. To do a stitching operation, you have to be a surgeon. Often you or the technical staff can't do it. And a small micro trowel so that the microtron, it's like a sharp needle in diameter, well, less than 1 millimeter, not a centimeter, millimeter diameter. To make small cuts with this tool. Well, now the guy won't happen there. At most, he will settle down badly and will exhaust the donor reserve.
I have another question regarding hair loss. Is it a disease at all? Don't answer. For the first time, you tell me,
When did they do it? You know, no matter what you compare it to, going to the dentist, but we're all afraid of the dentist, no matter how many times we've been there.
Like when they give you the first shot of anesthesia, but it's always painful. It's pretty much the same here.
same feeling?
Yes, that is, when the needle goes in, the needle is in, or whatever went in, that's all on the stage. The process of anesthesia has already started for you. That is, the whole hair transplant procedure is going on. You are practically as if you don't feel it. That is, you need to endure this period when they are giving injections. And returning to the question of Turkey, when I first learned that it was possible to do a transplant, this trichologist, a candidate of sciences, who, let's say, but generally not about that, she said, Alexei, if you're going to do it, then only not in Turkey. So it was still, how many, 5 years ago. So then she already understood and knew what was happening there. And accordingly, you don't need to be super smart here. I've been to Turkey several times, and if you've seen it, part of the operation is conducted there in hotels, and rooms are rented, and people are operated on in the first rooms.
It's worth noting because we once went to our Turkish colleagues like this, and let's just say it. Every second man has androgenic alopecia. That is, the market is huge. That is, even if there were 1,000 clinics in Moscow, it wouldn't be enough to restore everyone. So it's not about our patients not going to Turkey. Who can go? There are good clinics, there are good doctors, but the only thing I'm dealing with is a transplant up to the age of 1,998. Now, in Russia, there are a lot of good treatments. And in Peter, here, Siberia, and the Urals, I just know.
Well, you know, yes, that I have my second transplant already, yes. I visited a trichologist yesterday. Well, jumping ahead to the question, am I surviving or not? I'm saying you tell me, can, can't. What's with my hair? What's the situation? She told me I see transplanted hair, that is, they are there. There's a special device, there's a microscope. Well, I don't know how it's trichoscope, yes. That is, when you point at the hair and look closely, you can see exactly these follicular units. Well, that is these bulbs. She says, I see your transplanted hair, they are growing. But the hair that is mine, let's say native, they are slowly, gradually still falling out and falling out.
It turns out,
Now we have only the transplanted ones left.
And our own, not quite transplanted, just a little, but our own are also left. Because a person has a follicular unit on his head for 50,000, it's 150,000 hairs. In one follicular unit, I have up to 4 follicles. It's like a morphofunctional unit with a Kalmar. We transplant 2,000 to 3,000 maximum per operation. If a person is completely bald, 7th degree, then he has lost 30,000 such follicular units. We can't fully restore this. It's crucial to preserve your hair through proper treatment. Alexei should always be under a trichologist's supervision to maintain his transplanted hair. No additional treatment is necessary. They will grow and grow like a weed.
in short, the marking has already been done.
I'm already in surgical scrubs in the operating room.
They are waiting for me.
It's going to be very interesting now. Let's go, let's go, let's go. I saw it like this. In the morning, sometimes even a flap inflates. And this will be later, and this will be later.
Will be on anesthesia that is above the bandage. Should not numb all like this, not one tooth, not one piece. And
The entire scalp bent. He does not allow anesthesia to go below.
no, in order for the blood secretions to peroxide,
Spirit was released.
eyes did not pack clothes.
The patient must
See no bloody traces of the inspector losses. Here are the legs, everyone. Come on, here, Alexei. Now we feel any pain, I already said.
What's here? Yes, here it is. When they inject plasma, the sick plasma to the best, these injections, well, into what? I'll tell you one why.
So, because well, I don't know why so, but it's sick, honestly speaking. Well, but as a reason for action, or as you compared with plasma, but I want to praise Alexei, what you... A real man. A man should endure a couple of injections and not come out of it. The first few pricks, which, well, it's not so painful to react to this. And from this moment, you feel pressure, tension, like such a feeling that something is going into the skin, something to swell, until
It's painful while there is right now, while I don't feel even.
we feel this. It shouldn't be painful. You should have endured my injections. Now I will leave. Our nurses are adding anesthetic. All points should only feel pressure. If the pressure turns into burning, tingling, we just have to wait. Good.
But the actual distance from the skin to the skull is something that the liquid fills up.
Up 3 to 4 millimeters, visually more. He didn't mean how much the skin pulls away.
Somewhere there is a mizinek.
A little thinner. Let me show you what it rolls. So thin. Look, yes, it's an insulin syringe. Look how thin they are.
Sash, you're remarkably calm about all this.
You're watching. You saw what I'm unscrewing.
Operations, yes.
Of course.
I'm removing half a man.
Bubbles, bladder stones, prostate, there are reservoirs from the intestines. I form all this laparoscopically. That is this. For me, this is not serious at all in terms of blood there, but we are generally to this surgery. Although, let's say, I don't really like to watch someone cut a finger with a sheet of paper. Some triggers of mine. There are. I can't stand dentistry, here I am. When someone there drills a tooth, maxillofacial surgery, but so on the body.
Everything is calm.
Alexei should not hurt, there is no need to endure.
It's sad.
They didn't give. Now I started to feel.
A spread, such a small spread, that it's pressure, tension, given, sick, not to me. They are sickly fighting.
There should be no more pain.
There is pain. What? This is a diluted anesthetic, like a modernized solution, sticky there, and such 0.1%, not 2%, 0.1, that is 20 times diluted. What's wrong with you? That's why it works slowly. But the point is, as long as this solution it will work in the tissues, it does not break down in the liver. So we introduce a large amount of fluids, but there is little medicine there. That's why Alex came in. We didn't even measure the pulse, didn't ask how he feels. No heart attack, nothing that we thank. Because there are very few medicines, a lot of dilution. It's a physical dilution. They just dilute already, essentially. Broken, diluted physical dilution, so it works slowly. Therefore, if the patient feels any tingling, burning, you just need to wait.
But why not lose? Here he came, let's say, and starts with these rollers. I saw to drip castor oil in this on YouTube. It's us.
Let's make a video, let's do it. I always say, let's not need to invent a bicycle. Pathogenic mechanisms of androgenic alopecia have long been established. There is a treatment, he admits. This treatment is minoxidil oral or topical. And a colleague. 5-alpha reductase inhibitors without 5-alpha reductase inhibitors. Not a single trichologist, not a single hair transplantologist in civilized countries can do without it. This is very important. Our patients are afraid of side effects, but there are really no side effects in such dosages that we use. Finasteride, alpha reductase inhibitors were invented for the treatment of prostate adenoma. Better to know me. Let's explain.
In urology, certain drugs are used when a patient has a large adenoma and surgery is not desired, either due to the patient's preference or contraindications. There are medicines that belong to this group. They, so to speak, block the amount, to put it simply. Dihydrotestosterone is needed for the prostate to function well, and we can neutralize its excess and their actions with these drugs. That is, in fact, dihydrotestosterone is there, but it no longer works in such and such a volume as it should. While doing this, there are no side effects, but the gland starts to shrink. However, people start consuming huge doses to enhance the effect, resulting in a urological complication, sclerosis of the prostate gland. It is rarely written, but has been the case for many years. When they sit on them, and especially play with the doses, they get a reduction in the volume of the prostate sclerosis. They start to urinate.
You are using 5 milligrams of penosterine, at least 1 milligram, 1/5 of the dose. The problem is the long-term and short-term side effects, including depression, decreased libido, and erectile dysfunction. But such side effects occur in older men, and when they use such a dose, if we use 1 milligram, there are practically no side effects. Let's tell the truth. If our dear Alexei had taken these medicines, he would not have needed a second operation in any case now.
How do 5-alpha reductase inhibitors work? Testosterone is our primary hormone, while dihydrotestosterone is also crucial. It is responsible for libido and acts on the prostate gland, among other functions. These drugs, called 5-alpha reductase inhibitors, prevent the conversion of testosterone into dihydrotestosterone. Therefore, if your dihydrotestosterone is very high or your hair follicles are more sensitive, you may experience alopecia even when hormone levels appear relatively normal. Absolutely correct. And why didn't he become?
And now I will tell. I have stories on this topic. This was before the first transplant, so the trichologist really prescribed me. I started drinking. Well, yes, I'm quite active. There are always some meetings, affairs, there is something else. Winter, so I'm at home, 6 o'clock in the evening. My wife says, "Listen, Dam, cool, you came home so early today? Well, I have dinner and so on." Then another day goes by, and without noticing it myself, I have, some kind of relaxed state. Stay at home on the couch.
Lay down, disappeared?
That is, the fire disappeared. But I didn't connect this with the fact that I'm taking medication. Maybe it's not related.
Then wait for your wife, and you were this trichologist, something, or prescribed the game until prescribed some kind of drugs.
She looks at the year, where I look, she reads, and there in the instructions it is indicated that this is aspirin. Red, your skin should shed you there. So side effects are a decrease, let's say, in activity, their libido, everything else, So stop. In general, I skipped exactly a week. At the family council, we decided that it's better, psychogenic.
Psychogenic mechanisms exist, but in hair transplantation, arguing with the patient is unnecessary since the procedure is effective. But to close this topic, I want to tell 2 examples that I always remember. My partner Maladzi, he is 57 years old. Now he has a Chinese wife. He himself is bald. He has a 5-year-old child. He, in my opinion, has been on finasteride for 20 years. And he lives wonderfully, no problems. And my also friend, a very good hair transplantologist in Spain, Jose Lorenzo, he once said that he's on a double dose. I say, why are you on a double dose of finasteride? I would like to decrease my sexuality. He jokes like that. So these drugs are very effective and very useful, but not mandatory. That is, these drugs play against our business, against hair transplant surgeons. Because if they were not used, if patients regularly use them, then impotent procedures, transplants would not be needed.
They can just sit on the phone during the procedure, on the phone.
When it turns over, everything will be on the phone.
Music and headphones are also possible.
Put on small ones. People work on laptops, on tablets.
And if it gets cold,
if it's going to feed, then you can eat. You need to eat.
Now they've soaked, they look really worse. When dry, looked better. Now you've got such ones, like logs. Of course it looks.
Still all.
Last, from this side, all now already have a feeling or already not. Here.
Practically. There is practically none.
What are our main stages? It turns out to give again.
I'll sound then the first stage, but anesthesia, donor anesthesia, a recipe for a stranger, then at this method differs. Everyone works differently. Mostly under the majority of surgeons are attracted. Graft.
You.
Did you take it count? Then micro holes are made, micro channels, pits where we should plant them, and the last there are implants, that is 1 anesthesia, 2 graft extractions, hole making. And we just do it a little differently.
They make a hole and plant immediately, or do they first make...
Both holes, we do differently, anesthesia. We make all the micro holes, then we extract with a graft, then we plant. It's not me who came up with this, it's Bernstein, my mentor, Robert Bernstein. He works in New York. Why is this done? Micro holes, in any case, lungs, we will now show lungs. We have to make this microchannel where we then implant the graft. We have to do all of them anyway. That's why we think it's better to do it before the grafts are extracted, because when the extraction of grafts is finished, all the places will be ready. And they immediately took my fish from one aquarium and immediately put it in another.
They are outside the organism.
The less it will become sensitive. Always tells from his juice to live better high. What was the earthquake? My close friend. I don't practice witchcraft. Mogavo broke suddenly. All of Petri K's teacups. The grafts fell to the floor. No one cared about the operation. They just washed these grafts out of the solution and saved the failure. One here, half with half, on another day transplanted. No, let's not do such things. Better taken, immediately planted. Moreover, another advantage of these micro-incisions is that both formations are no less blood. And the third effect is a hypothetical plasma effect, lift copies. Platelets have already arrived there. How did you do the PERPI procedure? PERPI
therapy, what is it? They take your blood, and that fraction where the platelet-rich mass is, there are many growth factors. And so they did it to me. I filmed it. Maybe you saw it in the knee. They take it from the vein, the center of the figure, and a certain task to slide, in which these growth factors are. They inject into the knee. But they also use the same method when they try to improve the trophism of tissues. Here it happens naturally when thrombocytes come there, which try to stop the bleeding, but microscopic, but still they improve the blood supply there, that is engraftment. I work at the Federal Oncology Center, and many from the 90s are still going when they say that we have to fly to Israel, that we have to fly to Germany. And I constantly struggle with this, trying to prove by the example of my work, the work of our center, if a specific institution where you came in, it works according to the protocols, the established ones, then its treatment will not be different. Because there is a so-called guideline, that is, it's a release, a book that is updated every year. It says you need to do this and that under such and such a step. When they say that in Germany they will treat your liver differently, they won't actually treat it differently. If to operate differently means most likely someone somewhere is doing something wrong. Went off the guide. Our recommendations, Mindravovsky, are not different. It turns out, operating here in Moscow, in this clinic, the protocol is not the same. That the arrivals in Moscow and in this or that clinic, who the surgeons operate, they do poorly there because this is a Moscow clinic, and they do differently there.
Let's say this. There's no need to fly out of Russia. Russia has a lot of very good surgeons, indeed, very good academic ones. The basic principles of hair transplantation were formulated during the endoscope methods in the middle of the last century. To the 10th year after 10 years, no significant 50s, no significant such radical changes occur. All are operated by competent surgeons, all operate according to the same methods, and the methodology, another matter, how much methodology they do not use. These are the basic principles. Absolutely correctly formulated, the left step is needed. Step.
All right, can be done, just there are different diseases. His skin is normal. I know people who have severe dandruff, there's dermatitis and all sorts. Is it even a contraindication? Absolutely, that is, it can even be a wound, it is.
Contraindication of autoimmune disease. It's a good one. That autoimmune disease is Brack's disease. Did filari implant frontal fibrosis? These are the 2% which are alopecia, areatonesic alopecia, which do not need to be operated on or need to be operated on carefully. Why does hair transplantation work for androgenic alopecia, for burns, for scars? In one place there are no follicles, in another there are, and they are healthy and scared of falling factors. They have a more or less resistant hydrotestosterone. In autoimmune diseases, this is a condition when the body produces antibodies against its own cells regardless of their location. Therefore, in this case, if the process is ongoing and it is not stabilized, these autoimmune mechanisms can affect and oversaturate the cells. Let's say with frontal fibrosis, you transplant, the hair grows. After a year, after two, they start to die off because the body continues to produce
Antibodies. And if a person has diabetes?
And if a person has diabetes, diabetes is not considered
A contraindication, absolutely.
No, we don't even use antibiotics when we do it.
Why? Because diabetes worsens wound healing. And for example, when a person comes to us and we do some kind of plastic reconstructive surgery, if he has diabetes, then the chances from the classical and including transplantation, everything heals poorly. And with hair, it turns out this rule does not work.
And it doesn't work now either. I'll tell you why, because blood supply is very important, but not for hair. Even when a person dies for a few days, the hair grows. Polycules outdoors, once obtained, we store the physical substances, potentially for a day. They are not so ischemic, not so sensitive, and blood supply on the scalp is much better than on the body. Basically, if we injured our hand, a little bit of blood will flow. But if a stone hit our head, a wound on the scalp, blood flows in streams. That's why the scalp hurts more. We were fortunate as there were no infectious complications, necrosis, or significant issues with ischemia.
And to transplant, say we're talking about hair. For example, in some diseases, hair tends to fall out. Or here's a good, by the way, example of a funny, amusing one. I was surprised today. Who made me coffee, doctor? She says that Caucasian women are coming. And one of the requests she wants removed with a laser, hair, eyebrows, or even hair on the lobe. And the husband says, I like it when there is a little hair. And there are even such requests, and you can really come. And transplant and hair on the lobe, in principle. Yes, and where are they planted? On the lobe from the back of the head. Also with from the back of the head, so it's a universal donor zone. So even on the eyebrows, they will be
plant from the back of the head. Works best of all. I'm preparing the needles. It's a very small hole. We bend them. Can I show? Yes, of course.
Visible.
This is Mario Marzola, an Australian, came up with, here's how it bends. And it doesn't go any deeper. We don't need more than that. The follicle is located at a depth of 4 millimeters on average, so we have no risk, even if you are having a major operation. 45,000 necrosis of the recipient zone, which we talked about where we feel.
He has already relaxed, spoiled our strength.
This is the most unpleasant. The only unpleasant thing about the procedure, then everything goes smoothly.
Doesn't worry, Hans, the goal is warm, normal.
Already everything is behind.
Not wet.
Everything is already behind. Why are we now adding anesthetic? Not because it hurts. We've already blocked everything. Nothing hurts. But when we lift the skin, we get a few pluses in the first place. The fabric does not imbibe with the adrenaline-containing anesthetic solution, which will bleed less. Secondly, we rise from that horizontal vascular network that supplies the scalp, therefore the risk of their damage is reduced. That's why there are no complications that always cause a headache for surgeons. Bleeding and ischemia, damage to vessels. We are protected, the only unpleasant part for grafting when bringing, but during grafting is over. We will now start making channels. I will now pluck hairlines, and we count how many micro incisions were made. 20, 25, 20 will be 100, and now with that onto record. Look, we've passed. Everything is dry. Nothing is bleeding at all.
This is Leosha the Brave, or what? Brave, Leosha the Brave. So how? I don't even feel these. What I understand is some mechanical movements.
But he still feels my hand because he
is located
on it. And here is Mikhail, who works for a very hour. Yes.
You know, when you breathe, a woman stands. Hold his hand. Come on.
Come on.
Come on, everything will be fine.
Yes. This is the amount we count. Yes, we count. And how about there? Please, we have a machine that counts all this by itself. But now the corpse was more visible to our viewers. Just usual, everything is very simple.
Last time I remember, yes, I was getting some kind of machine.
With this machine,
I've seen some inventions now that supposedly adjust the graft themselves, but as I understand it, they've been trying to implement them for a long time.
She takes it herself and herself.
it wouldn't have been scary. And this is Artas Robot. We worked with this company. We trained doctors who came to us. The clinic bought the device, but the doctors don't know what,
Dermatologists are
let's say, or surgeons, like what is a hair transplant. We already conduct training, and in this clinic, so we train these doctors on this device. Plus the ergonomics of the device, you sit, mark the follicular unit on the screen, and the device itself extracts. For beginners, it's not bad, but so far this speed quality of implantation, the robot is worse than the human hand. Despite all the difficulties,
To be honest, I'd be scared to eat or get stitches from a robot.
truth is here,
Exactly like
to merge robot with robot, and it works slower, let's say, its extraction. On average, 5,500,600 grafts per hour. I and our doctors, like Dr. Mikhail, we extract somewhere around 1,020 on average. If for beginners this is not bad, those experienced, I'll honestly say, in the clinic which they bought, those experienced doctors. You can take it off, they might not use it later. Closer, show the line, grow even closer. We have such stakes here in a chess order, we try not to have a line. You've settled in well, you're the first ones.
good. Yes, in general.
Just moved in.
How many you see now? How many will be transplanting hair or not? More.
We will make a micro hole where needed. There we will puncture, and then we will take as many punctures as many grafts need to be taken. Now we are doing.
And now, just like that.
So we consider how much we see now, where it is required. Look. Show how the zone looks. Look between the hairs near the back. You can also, it's not worth looking. Look. Here are the transplanted hairs after the first operation. Between them,
There is a distance.
it requires that you poke there immediately. It shows a lot of intelligence is not needed here. Where there is an empty space, a place between the hairs, you feed, there will grow a poke. It will be thicker. We are moving with Mikhail and we'll meet on the Elbe. He is with Makushka. We are ahead. The first stage will be decided and needs to be finished in 1.5 months. Treatment takes a long time and will be done one by one.
They asked me to ask questions today. I say ask questions, I will ask. They say, is it true that they have been planted?
yes, these follicles, they were originally insensitive.
After 35 years, the hydrotestosterone suddenly changed and began falling out from the back.
I change. Very
Good question, very...
you. Good subscribers just means good. So, principle. The modern hair transplant was formed in the early 50s by Norman Oren Trachoma, an American dermatologist, who introduced the concept of donor dominance. This means that if we plant hair, the follicle in new places retains its anatomy. It has anatomical physiological properties there. That is, if we planted a tomato will grow. If we planted a cucumber will grow. That is, in new areas, the hair of the occipital part will grow, and these follicles will work all their life. But no 2006 a year. Korean surgeon Tom Yuan is my very good friend. He received the golden follicle for this research. He planted hair on the back of the head. And what does it look like? What is the Golden Follicle Award? I'll show you later how the follicle, this is our main award. He transplanted follicles on the palm and is part of the International Society for Hair Restoration. And he observed, well, of course, they came there, the hair was transplanted. Wherever they would transplant, they will grow. And he observed their growth. And after a few years, he saw that if he shaved on the back of his head, well, let's say,
The hair, well,
on the head, made a haircut, let's say once or twice a month. Well, for example, they started to grow slower. That is, they began to look like body hair. It's like how adopted children become similar to their parents. Parents, even though they are English, strangers, yes, or like how dogs seem to resemble their owners. Here are my twin sisters. They were born pure Georgians from Igre, and they are from the Galsky district. They were born in Moscow. Both are beauties. I look at them. There is nothing Georgian in appearance, although mom and dad are pure Georgians from Igre. And therefore, over time, the follicles are transplanted. We're talking about 5 to 10 such cases. But it's not proven. There's a hypothesis that they're all the same transplanted. The hair thins out. There's a miniaturization of them. But in most cases, the transplanted hair is practically eternal. And there's an observation, let's say for 15 to 20 years, they produce and give healthy hair.
And if it still falls out, then approximately what is the term? It is considered that the operation went well and they lasted at least. In the end, it didn't work out for the man. He fell into the small percentage where the follicle still changed. What is the duration of this condition? 10 years?
15 years? Somewhere from 5 to the end of life. The first 5 years are always good. If you're not very lucky, then it's 5 years. This doesn't mean all hair will fall out. The hair thins out and becomes thin.
What kind of guarantees does the specialist give? For example, he will perform the operation today. What are his guarantees that they will not fall out tomorrow? This is a good question. 5.
In medicine, guarantees are not given. But when I started this in Georgia in the year 1998, there were big doubts. Patients sometimes ask if mobile electromagnetic radiation causes brain cancer. And you transplant, hair grows in a year, and what if they don't grow? To address this issue, I've made a contract form where we guarantee the result. If there's no result, the hair didn't grow, the full amount is returned. And this simply removed a lot of headaches, even though it might be disadvantageous for the doctor. It removed a lot of headaches. So that patients don't question this experience, they know that everything will be fine. It's written there that there are no complications. Only when the hair starts to grow, sometimes there can be a couple of pimples. There are no pains during or after the operation because I use my method, which works for 12 hours. After 12 hours, the microcuts are already healing. Well, something like that. We shave, cut ourselves, stop the blood after 12 hours. Nothing hurts, the same thing. And the patient just knows that it's true, it will work because the clinic is obliged to. That is, they didn't grow. And how is this evaluated later, after a year? Treatment is crucial as sometimes after surgery, a patient's transplanted hair grows back, but their original hair falls out, resulting in hair loss. We always recommend treatment to patients, but even without it, it's very easy to establish, even without a trichoscope. Transplanted hairs on a shaved head differ from their own. Externally, they do not differ, but they are thicker. If you look at balding men on the top of the head, the hairs are as if thinned out.
On the back of the head, they are thicker, more
Darker, and it is immediately noticeable. You can count how much has survived. Survivability is mainly higher.
The operation is considered successful if 90% of the patients survive, but the question remains, what criteria determines success?
Yes, we guarantee 90% or more, because it's like, if done correctly, it's like transplanting seedlings, but if you've transplanted, there's a chance that something won't. But if you've done everything correctly, the roots around enough depth of soil, transplanted at the right time, it's good. No watering is needed here, but if done correctly, its own tissues adhere very well.
It's a pity, no, that, of course, the hair that falls out there for a whole half a year, the results of this have to wait, transplanted tomorrow. Everything is already there.
And this is a transplant of long hair when the hair is immediately and not falling out.
Falls out, falling.
But there is such a thing. You look in the mirror and everything, not such a picture. Well, very neat technique.
Very what? Again, and how I am neat, beautiful, clean, accurately, but it takes longer. Yes, this.
It goes to read though, because she is being done. Treatment is faster, and the landing
Longer. You know, we surgeons, by the look of it, believe that blue-eyed, red-haired
Survive. Do not operate on doctors. Do not operate on relatives. Do not operate.
redheads with blue eyes often stand out. This is really the case. Indeed, allergics bleed more heavily.
So for me, it's like I don't have blue eyes, I have brown ones.
Eyes, well, I don't know. I've never had a problem with it, no. Smooth. Very positive.
Man, in
2 will do. So I thought we'd get by with a local. Tally will become, and well, 2,000 is gone.
I think the main downside of this operation, the main downside of the operation is that you have to wait a very long time. Lying there, probably, while I'm the only one who sees that you're lying there and doing nothing, waiting. Well, yes, because usually operations there, you fell asleep, woke up, everything is finished, that's it.
The first stage is over.
We now...
How much time? As I said, half an hour. That is, sometimes it takes to prepare. You can take off. How?
The head looks, the projector on the apple is similar.
Now, the most interesting thing is we have holes.
Punctures, channels.
Dense, but not even now. Extraction of donors from the donor zone. How will we turn it over? And here?
Right in the middle, you can see only
Probably.
these markings. I thought the whole head would be, you know, like no projector, only right in the middle. I see them. And further, you somehow don't.
Strongly.
You can see for yourself.
Alexei, we get up, turn around, sit down, face down.
Good job.
I also flinched at injections. It hurts, didn't want to cause you pain.
I feel worse at the dentist's, to be honest.
You can sleep now when nothing is happening. The patient is face down. He can sleep. The soldier sleeps as time passes.
I definitely suffer more from the dentist.
The liquid has seeped through all the barriers, through the seams. That's why there is no such nimbus now in principle. Everything is not expressed as distributed.
This is a device that rotates the microtube punch. We call each microtube. There are many different microtubes. I use my own design. It has many advantages, as I think there are very many different ones. Sharp, blunt, tube-shaped, toothed, different. Because the main drawback of this method is recklessness. Plus, we know no seam, which means a high risk of graft damage. That's why every company, every surgeon thinks they can bring something of their own, improve the technology to reduce the damage. I think our punch is very good. I use only when I do long hair transplants. There is trepidation. Such a Paraguayan surgeon, his machine, his punch during the extraction of long hair and with short hair. Yes, there was.
There is such an anime, it's about a superhero.
Everything is amazing and hair-raising.
Makaki, he's a punchman. He killed all the enemies there with one blow.
Before this means a hit? Well, yes, look how it works. I insert a punch hair and it's spinning. It becomes a notch. And then look, here's a beautiful 3-hair graph. Let's do it one more time.
Like little worms on the hand.
Both of them.
Nurse's hands are with them.
That's the advantage of our poncho. The sting was deep and the count was late for it. In the depths of the forest. We made 2,000. Microdissection, that is a place for graft implantation, that is, we need it. Naturally, 2,000 grafts, 5,000 seedlings.
Somewhere around 1,000.
If not in a hurry, it takes an hour, so we will need somewhere up to 2 hours. Maybe we should look faster to take out the necessary amount. How is the graft count going? 50 molecular units are placed in each container.
And when it's full, we set it aside.
Like a dentist's drill bit.
Yes, like that, but Alexei felt no vibration or sensation at all. She still doesn't feel it.
You control the pedal gets.
I press this, it starts to spin. That's it. She filled 50 of mine from yours. These bowls will remind you of which principles are based on.
Distributed by a different container.
Degree, and there are 1, 2, and 3, and many haired single are laid separately twice from it. 1.
Hair grows.
Yes.
So it turns out we took a piece of fabric with hair, if there is one hair, in one container. If there are 2, another maximum 4 do.
Sometimes I had a case of 9 hairs, but this is a rarity. Mainly 3, 4, 5, 6. This is a rarity.
Only work in this Moscow clinic regardless of how often you fly in.
Depending on the patients this week, maximum 10 days.
In general, how long do they need to be observed? Look, they have transplanted, yes, shot and forgot.
Did it, no more observation. So it doesn't require transplanted the next day. The patient can wash his head as usual. These points go away in a maximum of 10 to 12 days. No colors. But there is another method that no one does in the Eastern Hemisphere. That's my favorite Marcel technique. And by the way, 2,600 brothers and hands fell. This is a transplant of long hair, when we transplant not just follicles, but follicles with long hair. But in the case of Alexei, this is short hair back, if the patient has more or less long hair. Well, I don't mean braids, but 2 or 3 centimeters are transplanted along the entire length, then these dots are not visible. No traces. A man leaves the clinic ready for the result, like after a hairdresser, no traces of intervention. And this technique is good because we don't work blindly. That is, you immediately see what comes out of it. That is, not red dots do you see on the head punctures where you inserted the graft.
And what's the result? You're better.
You distribute the thickness direction. But the main advantage of this method is that you immediately see the result. And after a year, you evaluate whether everything has taken or not. Because after the operation, all 100% of the hair on the head, then they fall out. Long ones you transplant, or short hair falls out. Like a tree, an apple. That is, they
all fall out and then
they start to grow. Yes, then the apples start.
And how long until the funeral?
Growth begins in 3 months. They fall out immediately. Shedding begins in 2 weeks. Most of the hair falls out in a month.
We go bald in a month, it's scary again. Conditionally, everything that was before.
We return, and then growth begins. And in a year, you can assess all the limits. Survived very easily, like me.
He's a check, that's how it starts. Something is breaking through, like straight grass.
But they don't all start at once, because a clock mechanism is involved there. A follicle works for 3 years, rests for 3 months. 30% of head follicles are always resting. Women with no hair loss issues may still shed hair while combing, indicating that those follicles have entered the resting phase. The resting stage is called the telogen stage. Then they return to the anagen stage, the active growth stage, and they produce hair. That's how the clockwork mechanism is activated with transplanted hair. That is, the hair begins to grow not all at once, but gradually. And they do not grow like sticks, but like fluff. That's it. Then it gets thicker, and the final result is a year and a half. Then the result does not increase. It is believed that everything has grown over the year. Probably they survive, grow, do not grow, and even I survive. It's surprising when a patient returns after a year, but it does happen. I've been working for 25 years, and I'm amazed at how it works. A person changes. So, in plastic surgery, only rhinoplasty works, no lift, nothing else. And after that, 2 different people can be.
I don't recall my hair falling out so actively during my last transplant. They undoubtedly fell out, though. But externally, I didn't notice this, maybe because I cut my hair short, probably, and I had a lot of my own hair. That is the biggest problem for me. in particular after the transplant was that my head was terribly itchy. That is, the procedure is going on. I understand. Engraftment, probably. Yes, I wanted to scratch my head, but it was impossible to scratch it.
Nowhere for the first week.
Yes.
Because...
Well, you could say many such small wounds. Accordingly, they start to come alive, well, like any other wound. And this, of course, was disturbing. And as part of that, I think the next day or the day after, I think I was even skiing. That is, after 2 transfers.
I had surgery in January, I remember, and 3 days later I went to Gudari, I went skiing. We always joke, what does a man look like after a monkey transplant? His hand is always on his head. First he scratches, then he has a rash. Mainly patients don't complain too much about individuality, especially skin.
Well, in the most sensitive sense on the head, the subcutaneous sensitivity, it changes after the operation.
Well, some decrease in sensitivity at the back of the head, not forward, right here. And then it recovers. And
I believe it was over a week, but I can't recall precisely how long.
A week for sure, sometimes 2 months.
Decrease, more than a week for sure. I didn't feel my whole head, and then it gradually came back. I think it's the opposite, a plus because there's no such irritation.
The informed consent or agreement mentions 3 side effects. I don't have any additional side effects beyond those listed. You mean a complication, right? Side effects are not complications and will pass on their own, such as temporary anemias. It lasts 2 months, well, in the worst case 6 months, and then none. When hair starts to regrow like adult hair after a month, folliculitis can occur, causing irritation. It's not an infection, no antibiotic. We don't use antibiotics after surgery because there are no infectious complications. And third, when we work between the hairs, a patient came, a woman with thin hair, wants to increase the thickness, we plant between her own. Sometimes shock, enhanced hair loss can occur in the post-operative period. All these 3 side effects, I would call them complications because they go by themselves. It's like a side effect.
And complications, honestly, as they are.
There used to be various kinds, but now there are none.
But what kind, for example, examples? Interesting that everything...
Is there any? With the method that we are working with now, we will work in the case of Alexei with a crazy technique. The main complication is unfortunately not only with Turkish colleagues, but many have this source of the donor zone. One of the issues is when too much of the occipital region is taken and the occiput appears eroded. There are hairs present, but on the occiput there are bald spots. I didn't know this. I call this a crime simply. When there is a law, how much you need to take, you take away, take away, take away. Then you have to already tighten these zones with the chest, with the belly, with the side. This is the most difficult, the most unpleasant thing with insane technique, which is very hard. Exhaustion of the donor zone. In strip methods, there are necroses of the donor zone, recipient zones, necroses. This is when a rough technique of creating micro-openings is used. Why? The blood supply to the scalp is very good, but our viewers may not know this. But the innervation and blood supply of the scalp occur through ascending vessels from below. And up here in the dark area, they end. This is the most poorly blood supplied area. And when you do too much scraping with coarse instruments without a limiter, you disrupt the microcirculation. Such microcirculations can form, but this is very rough technique. Nowadays, practically no one has this. Such complications, infectious complications, are rare. You need to try to make it heal. If you work cleanly, effectively, they are in the hotel, or if you observe the basic laws of asepsis, even I would say such an operation is not necessary. The level of pure dressing is enough to avoid infectious complications.
In the comments under this video, can you share any specific ways of treating dandruff that you've tried? Has anyone managed to overcome it or not? What have you tried that hasn't worked? Because there are different methods. Today, I already talked about one of the methods. There are also folk ones. So don't hesitate to comment directly under this video. And thank you in advance. As I'm laying out this process now, there are comments, I read them, ask why, like not Turkey. There, it might even be cheaper.
Will be. Now I will explain to you, I already said, that is, I am extracting each graft itself.
We strive to ensure that each graft is undamaged. Very good.
Quality, so that not a single hair grew out of it, and if it's triple, 3 hairs. If an inexperienced person does this, not to mention a doctor, a nurse, naturally the price will be lower. Like if you have a wedding, if you invited, let's say, Philip Kirkorov, Sting, or some singer, the price will be different. Let's say it like this.
Why wouldn't I fly somewhere? Well, naturally, I have aerophobia. If there's a chance to get somewhere quickly, by train or without a plane, of course, I would do it without a plane. So, for my convenience, I would have breakfast in the morning, arrive, do what I need to do, and then go home. For me, in terms of comfort, it's very important, rather than flying to another country and sitting there. It doesn't matter which one, absolutely not in Turkey though. Secondly, indeed, if it's a matter of quality, I'm personally even ready to overpay, but for them to do a quality job for me, not to sit for a year, wait for the result, and in the end get 2/3 of the grafts beaten. Because it was my nurse who did this, not the doctor. I think in general cosmetology is such a thing that it's not worth saving on. Of course, it's also not worth overpaying, but to do it recklessly just so that it doesn't look very beautiful on me later, it's better either not to do it at all or to do it beautifully and well.
You can have surgery in any country, including Turkey. There are good doctors there. But just to draw attention to 2 points, to operate
Doctor,
and to have access to grafts. To graft count. Do you understand?
that is, to be able to count. Here's a very important tip for you to allow you to count how many there actually were.
They planted 5,000 on paper for you, but in the end, they made 2,000.
And secondly, to have a doctor do this, and you could check this moment, control it.
And the third point, the ratio of 1, 2, 3 hair grafts to the first hair grafts should not be more than 15% of the total amount during the first operation. You understand, you can divide 3 hair grafts into 2, resulting in more grafts. And what about the hair for us? There are a lot of nuances, that is, they are
Cutting them.
They don't cut, they use small punches, and they kind of turn out like this. Why is she flipping? Is she laying? And we'll see how many triples, doubles, and singles he will have. Even though he is already Alexei, not a very good candidate. He has already done the first operation, his hair is thin. You understand? There are a lot of nuances there. In fact,
If you remove all these nuances in order to lie, to deceive,
to be honest,
when considering all factors, the price is ultimately the same.
to calculate the graph, they are very easy to calculate. Let's do it.
Stand operation. So stop. Now I'm going to calculate.
Somehow there is a treatment being produced. It also stores and wants to easily recalculate. You can visit a container and see how many there are and what will happen.
Or to say that you can photograph, I will count. And knowing this, they probably won't be able to deceive you because you will tell them in advance that you will be taking pictures.
Exactly.
This stage is completed. Look, it looks like they were shooting salt into the big one when he was stealing apples. Then, very likely, evenly, it sounds so funny, the word beautiful, but beautiful.
If I got sick, it was a little.
Not a retreat, by the way.
He's very handsome. We went to a restaurant in the evening.
I have 2 remaining subscriber questions, which is good.
Under everything.
Questions. Today's from the guys. My telegrams asked, so I fulfill their wish. Do you ask questions? Can the last question be about hair direction? That is, let's say,
I have this. Well,
of course, this
is it already. When crossing the street, look left, then right. In England, do the opposite. Yes, directed, that is, this is twice, 24, you should give this. The surgeon should do everything micro, that is, give direction. Because as you plant them like this, they will grow. Just like this from different sides will be very natural. So, if you look at Alexei, guessed that his hair was transplanted, thought that the man was losing hair for a couple of money, something that was transplanted from him to Satan. The main Plaszewski surgeons achieve results so that it is not visible that something is not rhinoplasty. Settled was not visible.
He made an invisible chest. In principle, I can go to the barber, say so, tell me, which side should the hair grow when you shave, and how?
And we don't need this, we know, like this and that. What we always joke to some extent, that I'm not a surgeon anymore. A hairdresser, we know this, should not know. When we do eyebrows, when we do lashes, it's also very important to give direction. There was silence on the other end.
The final question is probably the most unusual, but they asked to ask it. Let's say, for example, if Leshy had a twin brother or a neighbor with thick hair, we could transplant beautiful hair from his neighbor or twin brother to you.
Signatures. So like this, only one egg cell twins. But if they are one egg cell twins, I've done such operations, just youth wasn't interested in it, transferred from one to another. Everything is fine. He is equally bald. And they did the operation because of chemotherapy. One of the patients lost hair due to radiotherapy, but others can do so. But it won't work with a brother, a neighbor, a friend, a mother. It should only be their own hair. There are pros and cons to your own transplants. They take root. No care is needed and everything is fine. But the downside of transplantation is that the donor supply is limited, so we have to return to this issue. The main problem with hair transplant timing, take care of each seedling. They need to be opened enough to restore even large degrees of fallout at a normal distribution.
Our twins played rock, paper, scissors to decide who would go bald.
I gave them a hair. Will it work or not? So it was in 2003, 2002, 2003, 2005, 2006, until 2007. I was sick with this and did a lot of research.
Can I ask another question? He can be such a surreal, a little, you transplanted hair from one twin to another. One was enough for one. So all his donor area is gone?
No, we did from him to him.
2 operations. And how did they change? Well, let's say hypothetically, hair is only enough for one. Or one is bald, the other is hairy. Is that what you transplanted?
No. If they are identical twins, they are both equally bald.
No. One of them has gone bald, but there's enough donor area to only cover one of them.
Both will have the same donor area.
Yes, but it's too little. And if you take from the donor area, it will be noticeable. And you transplanted it to him. One has hair, the other is bald. And can he, for example, wear these hairs for 2 or 3 years, or 5 years, or 5 years, and then you transplant all these hairs back? In principle, it is possible.
So, such a thing is also possible. In principle, it is possible.
It seems to me I have a new idea for you.
News item. In principle, it's possible. Find them now and experiment. When low hairlines were made and it was rough, with the follicular unit extraction method, you can take transplanted hair and transplant it to other places so as not to lose it. So, this, in principle, can be done, but why do it? Do it right from the start and that's it.
I have the main questions in principle. I think he wanted to know something before this, ask something he wants.
Not really. We discussed the grafting methods, so...
In terms of quantity.
We also discussed...
In case of...
About the beard hair, that is, we discussed it on the beard. Yes, that is. Actually, I can come to you not just I want a beard, say I want it without hair, here.
Just like a beard. You draw...
Zone.
The beard grows, but it's very easy to restore. And because in this case we don't have that main problem of donor zone limitation, the patient has a lot of hair on the head, doesn't want to restore, then we don't have those limitations that occur with androgenic alopecia. Because the zone is large, there is little hair on the back of the head, it's very easy to restore the beard, and you don't have to worry so much about the direction of the hair. It always grows well, the beard always looks good.
I understand. The hardest part is at the back.
Remains.
We have the last stage left, to which the last stage transplant.
Refueling. Do we feel anything from these morning versions of these mooncrafts? I don't feel anything. And the pipe control, what's sick, is not an opinion.
A secret sum must be obtained discreetly.
Like to chip further?
So, how?
Is it done? Each assistant takes a container of grants. On the ladle, due to the forces of surface tension, this moist container sticks to the ladle. It won't fall out unless you shake your hand too much. There they take it with special tweezers. Look at these graphs and see how accurately the already created micro hole is inserted.
But now it's completely comfortable. I'm just sitting. I don't feel anything. What's happening on my head? I feel the hands. And accordingly, I see the hands. I don't feel any other mechanical movements. I think this is the stage of transplantation. It's the most comfortable, and it's comfortable to sit, and you can watch television and fiddle with your phone, so you can sit as long as you want. Oh, well, plus had a cup of coffee, had a snack. So it turns out this graph just put it in a box like that, and that's it.
Yes.
But how to understand how deep do you need to load there, or is he there?
This is a piece of skin.
To give so that it is not lower, not higher.
What is the budget checklist?
Oh, free.
Hooray.
Good.
So, thank you. Good. Yes, thank you. So, well, friends, everyone, the operation is over. Now you can relax and enjoy today and tomorrow and future periods. Everything went as comfortably and quickly as possible, but it only seemed that way to me. I'm not sure in any case.
Also, I think, in fact, the procedure is the same, in fact, really. Maybe because of this, it wasn't so painful, but I was interested, even though he said it wasn't for me. These are the coming years.
In terms of... But I at least know that it's absolutely bearable.
I understood how, what mechanics very much.
Questions about the process?
I looked from Hell-Eye, and plus I have one of such popular plane of request release. Just about the searches, that's YK. I found out that you're filming all this. I'm thinking, why not put it on my channel? So guys, don't be scared, it's real. The procedure, as it seemed to me, is delicate, but in terms of trauma to the body, compared to the operations we perform, it's a minor stress. And it's really cool that from the morning, conditionally, we had breakfast with him, came here, and now it's already 3 o'clock in the day, and he's not going to lie down.
7 hours already, yes, well.
Yes, to Panama. Friends, the day went great. I hope you liked it, if you like this format. And if you're interested, I think I'll be shooting something like this periodically. Because so much, unfortunately, surfaced today about who to do the procedures, how important it is, who will do it. And I would very much like to bring maximum benefit to you through such videos, so to speak, to show the other side, having this opportunity, being a doctor. Somewhere she used her own, but I don't know, mediocrity. Somewhere I used my acquaintances, connections to show this kitchen to everyone. And subtleties that you will never find anywhere on the internet to help you find the right place, find the right specialists, understand the methods. And be sure to write under this video what other procedures, what other places might be, or what you are interested in seeing on my channel. I read everything, I see everything, I collect feedback and make useful content for you, which helps you stay healthy. Have a good day.